Hi, everyone. My name is Shreya, and I'm one of the hosts of the podcast Mental Masala. I just want to say thank you so much for listening to another one of our episodes, and I am so excited to introduce a very special guest that we have today. So, our guest today is Dr. Bhatt, and instead of me giving a little introduction for her, Dr. Bhatt, would you like to kind of give a little background about maybe the work that you do and how it might be relevant to South Asian youth?
Yeah, thanks for having me, Shrey, on this podcast. I'm really excited. So my name is Dr. Apurva Bhatt. I'm a child, adolescent, and adult psychiatrist at Stanford University, and I do a lot of different things here. But related to this podcast, I work in two early psychosis clinics, both on the child side and on the adult side, called the Inspire Clinics or Child Inspire Clinic. And I specialize in psychosis evaluation and treatment. I'm also separately a school psychiatrist. So I work in several of our local Bay Area school districts as a psychiatry consultant. And then just a little bit about me and kind of my career and background. I'm actually originally from the Chicago suburbs, and I grew up in a multi-generational household in the burbs and went to public school there from a pretty young age. I knew I wanted to be a physician. I knew I wanted to help people. And my parents, were really supportive of kind of whatever career I was going to choose. I think there was maybe some hesitancy around going for medicine, which is a little bit different than maybe other South Asian families, but I knew that that's what I wanted to do, but I never got that message from them that that's what I should do. So I was really grateful that they allowed me to kind of fully explore what I wanted to do. I actually went to undergrad and med school together through a 6-year program at the University of Missouri, Kansas City, where I graduated with my MD and then went on to do my psychiatry residency at also in Kansas City, and then child psychiatry fellowship at UC Davis. And then right after that, I took my first job here at Stanford.
That's awesome. And you know what you were saying about the influence of your parents on kind of making that decision in medicine? I find that so relatable because right now I'm in this stage where I'm trying to figure out what I want to do for my career in the future. I'm very early on in my first year of undergrad. And it's really funny because although my parents are also South Asian, they've been very supportive of any career I want to do, and I'm just so grateful for that. And I find it very funny because oftentimes I joke with them and I'm like, why don't you just tell me what to do like every other South Asian parent does? It would make my life so much easier. I just want to know like what you guys think and everything like that. But I think in their experiences, taking that time to really explore what you want, even if it does take you maybe down a longer path or a less I don't know, intuitive one, that it's worth it in the end. So I think that's hilarious. I feel like I'm seeing the mirror of myself.
Yeah, it's really funny because I think for a long time, my dad really, he is in the computer science field. He's a
Mhm.
computer sales solutions architect and has worked at like tech companies. And that's not really what I like knew from a very early age that was not going to be my path. And yeah, I think I often see the other side where I remember even in the 6-year program, there were students like some of my peers who kind of were pressured to be there and how that sort of turned out for them and like honestly not in great ways. Sometimes it did work out, but I think for me, I was just really grateful they allowed me to follow my passion and just kind of supported me each step of the way.
Absolutely. Yeah. And I guess speaking of education, you had kind of talked about your work in supporting students at the university as a psychiatrist. And I think that's a really interesting experience and career choice that you made. Is there something that made you really want to support students in that way? Because I think when I hear most doctors kind of talk about their paths, it's almost like they're trying to get away from school a little bit initially after their education. They need a little bit of a break. But I'm just wondering, maybe what incentive you had or what desire you had to support students in that way.
Yeah. As a child psychiatrist, we work with kids who spend a majority of their time in school. And so
Mm.
I think, naturally, as being in the child psychiatry field, like you're going to be working with kids and engaging in schools in some way for all of our patients that we work with. So as part of my clinic, actually, part of the psychosis clinic, right, I work with like kids who are, experiencing psychosis who do go back to school, and I help advocate with the parents on the right kinds of supports for those kids so that they can have a really smooth transition back in. And many of the kids that I see in my Child Inspire clinic and Inspire on the adult side, the Inspire clinic, are high academic achieving kids. Like these are kids that were developing typically, and then all of a sudden had this episode and now
Mhm.
are navigating life after psychosis. And one of those things is going back to school and following their educational goals that they have for themselves. So I naturally interface with schools in that setting. And so as part of my other role as a school psychiatrist, the thing that really fueled me was just being able to support kids earlier in their journey, especially if they're starting to have mental health symptoms that are getting in the way of their ability to do well in school, to maintain social relationships, being able to support the school teams early on. And oftentimes what I do in that role is there are students that have already been identified by the mental health teams who the child might be struggling with something such as coming to school or maybe having really big behaviors or maybe having maybe depression symptoms or anxiety that the school is struggling to support that kid. And so
Mhm.
we actually do evaluations and then provide recommendations to the family and the school to offer multimodal support to that child. So thinking about the ways in which the school can better support them, understanding maybe from a diagnostic perspective what's going on, so that we can offer evidence-based multimodal treatment options like therapy, medications, lifestyle supports. And so just being able to like intervene early, like not waiting until that kid ends up in an ER or maybe in a more serious crisis situation. I think that's why I do it. And I honestly, I genuinely love working with the schools because they spend so much time with these kids. They really know them versus like on the outpatient side, right? I'm only seeing that kid in the context of my clinic, like what they look like when they show up. And so to be able to see them in their natural setting is a really fun time. And so like as part of our evals, I supervise child psychiatry fellows who observe the kid, not only interview and do a psych eval, a standard eval, but also they observe them in the classroom, they observe them at recess. They get a lot of history from the school team members and teachers to understand what's being observed. So it's a lot of fun, and it really helps identify kids, honestly, that probably aren't going to make it to our clinic or who might face a lot of barriers into coming into psychiatry or mental health care.
Yeah, and speaking of barriers to that mental health support, it's like what are kind of the main barriers you've noticed kids in your area or the kids that you support at schools? What are some of those barriers? Because I know obviously I think what first comes to mind are, especially in the United States, is, affordability, but are there any other types of barriers that you think people kind of overlook and that really need to be addressed?
Yeah, I think so. My clinic, the patients that I work with in our clinics are kids and young adults who live with psychosis. So it might be helpful to describe what that is, but this
For
is
sure.
a highly stigmatized experience. And so I think stigma is a big part of what gets in the way. Maybe I can talk a little bit about what psychosis is and then maybe how it might impact an individual, especially a young person. So psychosis is actually a constellation of experiences that is described by the DSM-5, which is the big book of how we diagnose mental disorders in the USA, by having several different symptom clusters. So one of them are hallucinations. These are experiences such as hearing sounds, seeing things, feeling things in your body that others don't. So hearing things that other people don't. It could be voices, it could be knocking, name being called, footsteps, ringing noises. There could also be visual experiences like seeing shadows or figures or having visual kind of distortions. So that's kind of the first symptom cluster is hallucinations. And those, when they're present, can be sometimes they don't cause any problem, and sometimes they can be really distressing. and get in the way of the individual's ability to do things that are meaningful to them, like maintain conversations with people or interact or do schoolwork or play in sports or do music. The second symptom cluster are delusions. These are unusual beliefs that enter one's mind that are not consistent with their culture, their religion, or their spirituality. And they're just, and sometimes beliefs that are present even when the person is presented with evidence that suggests that that belief is untrue. So these can take many forms. So one example is the sense of feeling followed, or someone's always watching you, someone is spying on you. There are cameras in the walls that are, monitoring your every move. Sometimes it could take the form of relating to your identity, like having special beliefs. Having special gifts or superpowers. The belief can honestly relate to anything, and there's many different kinds. The third symptom cluster is disorganization. So, and this can relate to the way in which someone communicates. So having the individual may have a much more difficult time communicating clearly or expressing their thoughts clearly. Sometimes they may become quiet or mute, or on the other side, be talking a lot, but in a way that makes no sense to other people. So they might be saying words and phrases and things that make sense to them, but other people are like scratching their head and not understanding, having a hard time like making sense of what the person is trying to communicate.
Mm-hmm.
Um, Disorganization can also affect one's thoughts. So some people living with psychosis will describe, my thoughts just feel really jumbled. They're going off track a lot. I feel like, they'll be trying to focus on something and notice that their thoughts just keep going off track frequently, no matter how much mental effort they try to focus on something. And then the last domain are negative symptoms. And this is sort of this also looks a little bit, there's a wide spectrum of how this can present, and not everyone experiences this, but essentially it's when someone may have lower motivation to do things that they used to enjoy, have a low motivation to take care of themselves, like doing basic hygiene activities can be really challenging. Sometimes doing daily living skills like taking care of your meals and getting up out of bed, experience the ability to experience joy, those things can happen, and it can kind of look like depression. So it's but it can happen to some people living with psychosis. So hallucinations, delusions, disorganized speech and communication or thinking. One other thing I forgot to mention is disorganized behavior, which is a change in behavior that, and it can look like just someone is being very quiet, frozen, or you're not really moving, all the way to like they're very agitated, pacing around a lot. No one understands what's going on with them. They're not able to communicate what's happening, or they're having really unpredictable behavior that's hard to understand by others. There's a very wide spectrum of how that can show up. So going back, the symptom domains are hallucinations, delusions, disorganized speech and behavior, and negative symptoms. When those are present together, and it can be any combination of those per the DSM, although you have to have hallucinations, delusions, or disorganized speech as one of the requirement to be able to receive a diagnosis of psychosis. If those experiences are present to a level that is causing distress or impact, then we would label it as psychosis.
Mm-hmm.
That was a lot.
No, this is such good background information because I don't know, at least in my family and even with the friends I have and stuff, I think there's a lot of misinformation about what psychosis is and what other mental health conditions or disorders might look like. So I think it's really nice to see how there's, I don't know, like a definite criteria almost that professionals use to diagnose individuals and support them. Because I think that's, at least in my experience, I think that's what kind of contributes to a little bit of the stigma, especially in the South Asian community, when
Yeah.
either parents, friends, like cultural groups, whatever it may be, they almost approach like mental health as something that is very kind of up in the air. It's not definite. So like what is a diagnosis? Like how is that even beneficial? Or, like does this person even have something serious, So I think it's really nice to have those different criteria and those categories to define what some mental illnesses might look like so individuals can be supported.
Yeah, and one other thing I'll add is, part of it, at least in the South Asian community, there aren't words that translate easily. Like in Gujarati, like there's no word for psychosis. It's just either
Mhm.
you're crazy or you're not. There's a term of like tension, like where if somebody is like agitated or stressed or anxious.
Hmm.
But actually, like it kind of even boils down to the language that people have. Is it accessible to map onto their experiences? And
Hmm.
sometimes there are experiences that happen to people that don't map on nicely to their native language or like, where their family might be from. And so that also sometimes causes challenges in terms of understanding what the experience is, and like what kind of like, I guess, cultural treatments would be accepted in
Hmm.
the family. Because if you don't have the word to describe what it is, like for example, like we hear the word diabetes and we know our mind immediately jumps to treatment options.
Hmm.
um, I think generally people kind of know like what you would need to do to manage that. But when it comes to things like this, where this is a term that is kind of novel, maybe to some languages and cultures, like they may not then it's there's more unknown, I think, associated with it. And then on top of that, more fear and then potentially more stigma.
Absolutely. And speaking of stigma, have you noticed any, and this might not even be specific to the South Asian community only, but are there any kind of cultural stigmas you have noticed around psychosis and mental health in your day-to-day career? Just because I know, I guess the word stigma, I've thrown it around quite a bit, but I don't know, are there any maybe examples or problems you kind of encounter with your work related to those stigmas?
Yeah, for sure. We know that, I mean, in the US at least, psychosis is a highly stigmatized experience. I think there's a lot of work to be done to help society in general understand what this is and treat people with more grace, and kindness and understanding. I will say in the South Asian community, there's a few things. I'll kind of paint the picture of like the typical person that comes to my clinic.
Hmm.
So and I will say, like, I work with a predominantly South Asian youth panel. Like most of the kids on my panel, like 60%, upwards of 60%, 60 to 80% have South Asian background.
Oh,
Either
wow.
they are immigrants themselves from India or the South Asian subcontinent, or they are children of immigrants.
Hmm.
So it's a huge population that I'm working with. I feel like that's within our community,
Hmm.
and a majority of them, I would say the typical profile of my kids is that they were just a typical developing kid, growing up in a South Asian household. Sometimes it's a multi-generational household, so they'll have like a grandparent living with them for a few months along, and that who then goes back to their home country. And these are usually high achieving kids. They are kids that were kind of just living a normal life, and then suddenly this thing happened. Oftentimes there is family history of this. Usually some family member living back in India, or a first degree relative, like a parent or a sibling or a grandparent, or aunt or uncle who also has this. And these kids usually don't seek out care early. Like most of them are coming to me after they've been to the ER or have already been hospitalized for their first episode of psychosis. And the family is now like reacting in terms of trying to get them into care and, get them the best care possible. Um, when they first come in and I'm doing my diagnostic eval and I'm saying, hey, I think this is a psychotic disorder, whether it relates to schizophrenia or schizoaffective disorder. These are like or even bipolar disorder or depression with psychotic features. Um, I do see family members have a variety of reactions. Some families where they have a family member that's doing well living with the condition, they come in and they kind of know what it is, and they've been able to see uh that family member is doing well. And so then when their kid comes in, I think they have a honestly less stigma in their mind, related to the diagnosis, because they've met somebody who's living with it and is doing well.
Hmm.
um, I also work with families where maybe it's not talked about. And this is probably more common, honestly, where they know that this relative in India or some other country, South Asian country, had some mental problem. it was sort of kept under wraps, like no one really talked about it. It was maybe a taboo topic to bring up with the family. Maybe that person took treatment or maybe they didn't. A lot of the times I hear that on and off treatment, or maybe did not seek out treatment and are just maintained at home with a community kind of supporting them in the home country. And parents feel really scared because they're
Mhm.
worried that their child is going to end up like that family member who may not be doing well. And there's just a lot more unknown. And in those families, I have to do a lot of education and
Mhm.
encourage them to join like family groups and like meet other people living with psychosis, meet our other kids living with it, so that they feel like they can see that there's like light at the end of the tunnel, that, you know, a majority of individuals will experience some improvement or almost complete remission of their symptoms, that they can go back to pursuing their goals, and that I'm here, you know, to kind of help support that. But the stigma is real. And I think it's one of the reasons why families don't come to me sooner. Like they might be noticing changes in their child or their loved one, but then they don't seek out care. Like they don't realize that, like, oh, this is something that I should go to a psychiatrist for. I think they just attribute it to other things, or maybe don't fully understand, or maybe it's not even, the symptoms aren't that bad. Like my patient is like able to contain the experience and kind of still squeak along with school and all the things that are expected of them. And so, yeah, the stigma is real. It's there. I have seen some families where it's maybe less prevalent, honestly, because they've had exposure to it and they've been through the treatment for it. Um, I think also there's some level of like intergenerational trauma that can also impact how the family reacts to the diagnosis. So there's a lot I think that's present in the
Absolutely.
community.
I guess speaking about intergenerational trauma, that concept, I think that's so interesting because I don't know, again, I keep on bringing this back to my personal life, but I think the people around me, especially, there's a little bit more conversation, in at least my education as well on social media about what intergenerational trauma is and like how it might have impacted even my parents and their parenting styles and their approaches to mental health. I think that's something that's so important to really recognize because again, I feel like people now luckily I don't think it's as um for lack of a better word like as fluffy of a term, but I think in the past it didn't have much weight or there wasn't a sense of importance about it, which I think is really important to recognize. Because I don't know, I just what change can come from not being able to recognize a lot of those root causes.
Yeah. I think it's so important to understand your family's lore. You know, like just to
Mhm.
understand. I really like understanding, like, okay, like what was the context in which they were living? What are some of the amazing things, amazing times that they lived through in their wherever, you know, their home country is or home city is? And then what were the things that were really stressful?
Absolutely.
What socio-political things happened that contributed to trauma, or potential trauma? And trauma, you know, it's not that all people have to have trauma symptoms of like PTSD, but certain patterns of behavior or ways in which they react to situations can emerge as a result of exposure to different sociopolitical events, that then lead to like survival traits, that then get passed down, even though the family is not living in that same city, that same sociopolitical context, right? Like you might have immigrated to a whole new country, but now there are patterns and behaviors that family members have brought with them that are just so ingrained in the ways in which they walk the world. And so as someone, as like, you know, all of us should be interrogating that, you know, and understanding like, oh, that's why we do certain things this way. Or, hey, maybe I wonder if this behavior ties back to that one, you know, really traumatic thing that happened when my parents were growing up. And I think that stuff really passes down, you know, whether or not we are aware of it. Sometimes it's subconscious behavior, or patterns of how we react to situations, the way in which emotions were expressed in families, who gets to express emotion in the family based on gender norms and cultural norms. Um, So yeah, there's just understanding the lore is so important. And like opening those conversations and being curious with your parents can be so interesting and helpful. And I think can then put context behind the ways in which they parented and then how they continue to kind of walk the world and maybe in the ways in which we all have inherited certain traits or quirks about how we also walk the world. And then the beautiful thing is like, at least for my young people that I work with, I help them interrogate some of that, especially if there are things that are not helpful. So for example, I've worked with some individuals where like they're young South Asian boys, like high school kids, I shouldn't say kids, maybe high school teenagers who, have had a first episode of psychosis and, they feel this pressure to not be able to express their emotions. Like you must be stoic, you must contain everything, and that's not helpful in their current context, and sometimes it leads to some level of personal suffering. And so helping them explore like, okay, like what's your dad like, what are your grandparents like, what kind of things did they live through? Maybe the socio-political events that they lived through made it unsafe for them to express emotions, and so they developed this coping mechanism or survival mechanism that may not map onto your situation, and now the kid gets to choose how they want to deal with things that come up. So it comes up a lot. I think I try to help them understand the lore.
Absolutely. And I guess kind of speaking, I know we have gotten into a little bit of your approach to treatment. So working with youth specifically, I imagine that's pretty different from maybe how a psychiatrist might be able to work with adults because teenagers, kids, teenagers, young adults, because I guess they are in a very vulnerable stage of life, even myself. Is there a different approach you've kind of had to adopt, especially given all of that specialization you have in helping youth with their treatment?
Yeah. Yeah, there are, I will say the treatment approaches, at least for psychosis, but mental health in general, are similar, but there are some important key differences when you're working with someone under the age of 18. So when you're working with a young person who's under 18, I really value and I center their goals and preferences. Like that is the most important thing for me because they're the ones taking the treatment or participating in the treatment. And so I really make sure I understand their values, their goals, their preferences. And then I try to center every treatment decision around that.
Mhm.
And we use actually a form of decision making called shared decision making to do that. And so that's where we invite the young person and their parents or caregivers, or if it is a young adult, like whoever they would like to participate in that process, if they want anyone to participate. And then I kind of lay out the evidence base. I invite them to, hey, there's a decision to be made here. And guess what? Like you get to make it. And my job is to give you the options, which are the evidence-based treatment options for this thing. And it could be a decision related to anything. It doesn't have to be related to medications or labs or health. It could be like, do you want to go start volunteering at the pet shelter? Like it could, and then so we go over each of the different options and then describe the positives and negatives of each. And then at the end, the young person gets to ask questions. The parent or caregiver support person asks questions about it, about the different options. And then from there, they get to make a decision. And I think that's makes it a lot easier. Especially for young people, it's really important to involve them early. You don't want to wait until they're 18 to start participating in decisions related to their life. Of course, we need parents and caregivers to help guide them and make sure that they're making safe decisions because we know teenagers can be more impulsive, and make silly decisions, and then there are opportunities for them to learn from their missteps. But we really want to scaffold that and help them prepare by the time they're 18. And so all my young people, I start practicing that as young as like they come. And even my little like 6, 7 year olds, 8 year olds who we see in clinic, I ask them like what they think about their treatment and what their preferences are and what they like and don't like about it. And I do that process from a young age so that by the time they're adults, they're ready to go. They're able to advocate for themselves and have that practice of thinking through decision making, so that even if they're in a situation where they're by themselves and don't have a support person, they know how to do it. Um, and so there are some different key differences, I think, like there. I do that with my young adults as well. When it comes to supporting these young people in and making sure that like I'm really hearing them, sometimes this happens a lot actually, where the kid is growing up in the US, they have certain language around how they're describing their experiences. And honestly, after they've had this experience of psychosis, many of them will read about it, they're participating in treatment, they really understand what it is from the Western model.
Mhm.
And sometimes if they prefer, we'll incorporate Eastern models of understanding too. But generally, a lot of them are, they're assimilating, they're acculturating, they're used to being part of Western culture. And so they kind of prefer that explanation. But sometimes there's a difference in how the parents or caregivers think about it.
Mhm.
And like they may not subscribe to the Western model of conceptualizing a certain behavior or a diagnosis or treatment model. And then my job is to remain humble, understand kind of all the values and perspectives that are there in that room, and then try to help bridge that. So help the parents and the kid understand each other a little bit better so that they can get closer and on the same page related to like treatment or understanding of it. And that takes time. There are some families that they get to that really quickly, and sometimes it takes a lot of time. For some parents it can take a long time for them to accept that their child has a mental health condition, whether it's a pediatric age or adult age person. And so just kind of always being available to answer questions and like help bridge that gap a little bit so that the burden doesn't fall on my patient to explain everything to them.
Mhm.
And for that reason, all of my appointments are 60 minutes. Like I don't do fast 30-minute appointments because I think there's so much work to be done. Because I know if I can do good work with this family,
Mhm.
they are then going to naturally be good advocates in the community. So if they recognize or hear about someone else having a mental health concern, they'll be able to talk about it. They'll have done the work so that they can reach out and make sure that the community is supported.
Absolutely. And I guess speaking about, them spreading a little bit of awareness about mental health in their communities, have you seen some improvement in your career so far in the South Asian community and some of those conversations that have been starting? Even like, I don't know, the local Gurdwara or temple, like, I think there's so much conversation that happens, about like sharing information about families. Oh, how is your daughter doing? Things like that. I think there's so much room and potential to like have those casual conversations without people even realizing it. And yeah, I don't know, in your experience, have you found that to be a little bit successful?
Yeah, I think it's getting better in the community.
Mhm.
I think, of course, there are always, it's a spectrum of people understanding this and folks that really are kind of new to it. But generally, I think part of the reason I've seen it really become a little bit more acceptable. Again, also acknowledging that there's a spectrum of families and individuals, but is social media actually. I think there's a
Oh,
lot more
yeah.
individuals sharing their story. Like for example, even just recently, like Honey Singh, who is an
Mhm.
amazing musician, artist, who has his Netflix special. Shout out to him for sharing his story so vulnerably. Folks like that. And I don't know if have you seen that documentary or heard a bit about it?
No, I haven't. I've heard about it a little bit, but I haven't seen it. I need to check it
Oh,
out.
it's so good. It's so good. So he just to, like briefly about him,
Hmm.
he was very famous kind of in the early 2000s and honestly was a really big deal. I mean, he was like blowing up internationally and was on tour
Absolutely.
and
Oh,
then had his like first episode of psychosis actually
oh wow.
in his 20s. And then, because of the symptoms, I think, he describes like how debilitating it was and how his mind was just not the same when he was in the state of psychosis and how it was really a long journey to get care and the kind of care that his body responded to, and sort of the stigma and the things that he faced related to that condition. He also talks about the amazing support his family gave him and like how, I mean, that part of the documentary, I was in tears because I see that with so many of the young people I work with. I think that's one of the best strengths of the South Asian community is like parents and their kids are just there's such a tight community of support there kind of
Mhm.
naturally. And anyway, so in the documentary, he talks about that. And now he's like, he talks about he's taking the medications that he takes and the treatment he had to go through to be able to recover. And how he's doing well now and like he's making amazing music again. And it's been just so lovely seeing him pursue his goals and like live the life that I think he wanted to live. Where psychosis isn't in the way of it. He clearly has learned to live alongside it, and is talking about it. And I think that's one of the main reasons I think it's just talked about more in general, mental health. And so there's a lot of initiatives like that
Mhm.
that exist out there, organizations that do storytelling. There's one organization that I volunteer for called Our Cause that it has a blog and different people sharing their stories around mental health. So the more people can share their stories, I think the better, because then it makes it a little bit easier for folks to reach out for help and for folks to check in on each other when they're concerned.
Yeah, absolutely. And the fact that you were talking about how tight-knit the South Asian community is, I've always seen it as not necessarily a weakness, but I love that you've pointed out that it does have a lot of strength because I think especially when you talk about mental health, or at least the way I've seen it, I've thought about the tight or like the closeness of the South Asian community as almost adding this level of pressure and especially for youth, maybe
Yeah.
like this anxiety or hesitancy to kind of share what they're really going through because there are so many people that you need to kind of worry about, maybe bringing shame upon or um, so many expectations that are put upon you. But I think there is something so like powerful to be said about how those close connections also provide so much support. So thank you for that because I think that's something I had never really thought about before. I kind of viewed it as a little bit of a of a black and white situation. So I
Yeah.
think, yeah, that approach, I imagine it must be so helpful for the way you help treat your patients, kind of recognizing that you're working with the family and you're kind of taking advantage of that profound love that, South Asian parents have for their kids, and you're channeling it to, a support system instead of trying to like almost like sever that a little bit, because I think maybe that's the approach some people have with mental health that I don't know if there's something that's kind of um, making your, recovery a little bit more difficult just to kind of separate it completely. But I think your approach is so interesting that you're kind of embracing some of that closeness. So, yeah, I love that.
Yeah. Yeah, and I think that's something that I really try to encourage like a lot of the families that I work with to maintain, like is that community connection.
Hmm.
And also recognizing that like the ways in which people show care and love across cultures is different. Like for example, like I grew up in a community where, if one of my neighbors, like South Asian neighbors, knew that like someone was sick or someone was in the hospital or, things were really stressed out, like they would send food. Like they would send
Yeah.
us, like I'm Gujarati, so they're gonna send like thepla, debra, dokra, like all the different Guju foods. And
Absolutely.
it was this quiet sort of support. Like that's the way in which they express, like, I really care about you. They may not have the language to say, hey, how are you doing? And let's talk about mental health. Like that, they don't know, they may not be there yet, but also recognizing like there are really amazing ways in which we show that we care for each other. And when people do go show those acts of care, right? Let's say you have a family member that's struggling with mental health and the neighbor knows or another family member knows, extended family knows, and they're coming and bringing over food. It's like, it's that opportunity to maybe be slightly vulnerable. And it has to be done carefully, respecting, the individual who's living with the mental illness, but also like, I think sometimes secrets contribute to a lot more shame and guilt.
Hmm.
Sometimes secrets are important and are necessary for survival, because it may not be safe to share at that point in time that, hey, I've got a mental health thing going on, but kind of testing the waters, and like slow exposure is kind of how I talk to my young people about it. And not no need to over disclose, right? You can share the bare minimum of like, yeah, I've got a mental health thing, and I'm actually doing a lot better now. Thanks for asking and thanks for bringing food.
Mhm.
Something like keeping it real generic, but like throwing it in there slowly.
Yeah.
Um, I think I've seen that help folks. And I think like, yeah, two things can be true at the same time, right? The community being so tight and so close and a little bit enmeshed can contribute to amazing things, but also can be a source of pressure. And so learning to navigate and identify that if it's happening to you is a big thing. I know a lot of the kids I work with do face maybe some level of feeling compared to other kids like that are around their age that are in the South Asian community. And that's almost like a cultural thing. I feel like it's like a intergenerational cultural behavior that we see. Like I think most of the millennials and even folks, the Gen Z folks, like they who are
Mhm.
born and brought up in the US probably aren't doing that as much.
Mhm.
But it is more normative like in South Asian countries. And so then it's like, okay, like giving parents and adults, I guess, grace if they're doing that and understanding that, okay, like that's where they grew up. That's normal where they grew up.
Mhm.
And maybe not taking it so to heart and really owning your authenticity when
Yeah,
you
absolutely. This it's a little bit off topic, but this reminds me of like the stories my mom used to share about her childhood because she was a first generation immigrant and she grew up in Detroit in Michigan, and she used to kind of tell me these stories about, like spelling bee competitions in front of all the parents and kind of pitting each kid against each other and stuff. So I think and I just think to that, I'm like, oh my God, if you ever did that to me, mom, I'd be like, oh God, I'm not talking to you. But it's just so interesting that that kind of stuff was normalized. And not to say that it was coming from a place of hate or anything, or like or jealousy and stuff, maybe a little bit from some family members, but I think sometimes that's just the way of the time and that generation, that older generation.
Mhm.
But I think it's just so interesting the way that, mental health or narratives about mental health really shift, and how support
Mhm.
systems shift as well, because I think even for, what my mom experienced, that's not to say that those family members wouldn't be there for her in a difficult time, because absolutely they would. That's
Right.
just a part of the South Asian culture. But I think it's just expressed in different ways, and that does obviously make it very difficult. Like that expressing the way we express love, and combined with the language barrier, and combined with even some stigmas maybe related to like religion and like other cultural stigmas. I think it makes it really difficult in some ways, but like you said, there's so many opportunities to kind of build those deep connections as well that maybe other cultures might not be able to relate to. And even I'm now in our conversation kind of discovering. So that's pretty awesome.
Yeah. I love that your mom broke whatever intergenerational thing there was around spelling bees. I mean, yeah, I think, and like parents, I genuinely believe like all parents are doing their best. I don't think that they
Mhm.
intentionally mean to harm their kids or hurt their kids. They
Absolutely.
will inevitably do it, right? That's just life. That's just every generation, right? There's no perfect parent out there. It doesn't exist.
Absolutely.
And especially if you're living in a different context, like cultural context than your parents, there's just more room for gaps in communication, gaps in understanding of things, or differences in how things are understood.
Mhm.
And looking for those opportunities where like you can recognize like, oh, they are trying to show that they care, and also that like there are these things, it's just going to take time for them to change, or maybe I accept how they are. And um I think acceptance is really important too, because like not all parents are going to be on the journey of change. um and
Absolutely.
so I think that's another important piece too, is like, okay, how do I navigate alongside them, even though I know they have these differences in thinking or beliefs around like my mental health condition,
Hmm.
and finding opportunities for shared joy, shared activities, and starting, it could be small, like going on a walk together or cooking together or like doing silly things like, random activities.
Yeah, absolutely. And I guess speaking about barriers to some of the stigma and kind of embracing the South Asian like culture around mental health and communication, have you found it helpful at all to, because Ayurvedic medicine, that's pretty like it's a big part of, like, at least in my family. even though my parents, they grew up in the US, like they're pretty integrated into Western culture. There are some things like, for example, like Eastern medicine that are just almost, I feel like they're always going to be kind of a part of our culture. Have you found kind of trying to approach treatment, kind of recognizing some of those treatment options? Have you found that helpful? Even if it's not
Yeah.
necessarily gonna obviously give those same results. Have you found a way to kind of almost work with families and I don't know, I've heard some mental health professionals and medical professionals say like there's a way, there's almost room for both options and it can kind of
Right.
help the patient even more. Have you found things like that helpful?
Yeah, I think first and foremost, like, I mean, I take a very humble approach.
Hmm.
I acknowledge that yes, there are real benefits for Western treatment options, and there's real limitations. Like, there's things
Absolutely.
that our treatments are not going to work for. And so holding space for that. Um, I think the other piece of it is if it is really important to a family, like I'm willing to walk that journey, with
Mhm.
them of exploring these things. I have to acknowledge that I'm not trained in Ayurvedic medicine, but if they are really intent on trying this kind of treatment, I'm willing to work with, another practitioner that specializes in that, and then making sure that it doesn't interact with any of the things that they take or that, could cause the mental health symptoms to worsen. So my approach is always collaborative. Um, I don't like, I try not to take a hard stance. I mean, there are times where if there is a real danger risk or, real black box warning or something of some sort, or a real drug interaction, with the medication that they take, or there's real potential for harm, I of course, step in and say, hey, like I'm really worried about this. But I always take a collaborative approach. And I think, people are on their own journeys. And I think young people know what works and they know what doesn't work. And so it's kind of up to them around what they have found helpful, what they have found is not helpful, and then helping them support their decisions around their care, so that they can make safe decisions, and decisions that are in alignment with their future goals. Like if their goal is to go back to school,
Mhm.
then making sure that both the Western medication and if they choose to take Ayurveda are not going to get in the way of that. So
Yeah.
it always comes back to their goal, and I take a
Mhm.
collaborative approach.
Absolutely. And speaking of goals, I know Um, I'm sure you find so much fulfillment from being able to see youth who've come to you in such a like a vulnerable time, such a like a time of uncertainty, and obviously maybe not always, but for at least quite a few, they're able to kind of leave or continue on with their treatment with almost this new sense of hope. And have you had any instances that, have really stood out to you, where you've just been like, whoa, my work is just so fulfilling to me. And it was just really evident of, like the impact that you're having.
Yeah. I'll start with saying I really love what I do. I mean, I feel really
Mhm.
lucky to be able to work with these families and work with these young people, and like to see these kids grow up, and pursue their goals and achieve the things that they set out to do, and kind of being there with them when they do struggle too, right? And helping kind of support them to get back to where they want to get to. Um, you know, I have learned that I can't assume like how far someone's going to go. I think that's like one thing I learned, all the if you look at psychosis research and a lot of the adult literature, it's quite depressing. I mean, some of it is like, especially if the symptoms emerged in childhood, the research papers will always say something like, oh, there's a poor prognosis. And I just have not seen that, honestly. Like,
Mhm.
and I think part of it is those research studies are really biased. The people that are doing well living with psychosis, probably don't have time to do research studies, or do these things, right? They're in college, they're employed, they have families, like they don't have time for that kind of stuff.
Mhm.
Um, I think for me, each of the young people that I work with, like I just love walking that journey with them. I like seeing the things that they're interested in and then helping them get back into that thing, or discover new interests and hobbies. The beautiful thing about adolescence is that your identity is shifting. And it isn't until honestly like 20s or even 30s where people really have that solid sense of like their interests and things that they're super into. And so just being able to see that is amazing. And I think also to see one thing that I really enjoy is when there's like always a moment where like sometimes you see the conflict between the kid and the parent or the kid and, whoever is the caregiver. But then there's a moment that comes along the treatment journey where like you can just tell they're on the same page. And it feels really good when that happens because like you can see that there's mutual understanding. They've learned how to communicate effectively. They've learned how to support one another. A lot of the kids that come to me, like a lot of mine right now are applying, they're high schoolers who will be graduating and going to college. And so they've done
Oh
their
yeah.
college applications and
Mhm.
they've had to explain, like, oh, yeah, I missed some school because of, I was hospitalized, I have a mental health condition. And it's just so interesting to see like the parents kind of, I think a lot of them are honestly really surprised when their kids achieve things that they didn't imagine for them.
Mhm.
Um, and it's just so it's humbling and it's so rewarding because and then the kids will even show like, hey mom, I'm gonna be okay. Like I've seen that. I've seen kids say that in my clinic.
Yeah.
Or parents will be like, I'm really worried about them going off to college. And the kid will like reassure them, and it's adorable. It's a very heartwarming experience to see that. And or if they don't feel ready, then the kid will be like, what do I need to do to get ready? And so then we talk about the different skills of living independently that they might want to work on, and we do that together. So
Wow. Hmm.
yeah, this past year, like every single of the high school kids that I work with went to college. Some of them got into Ivy Leagues, some of them are playing sports at a high level, like D1 sports. And so it's amazing to see like the things that they're able to achieve and while living alongside this thing and while living alongside maybe the community, the ways in which the community views it, and then redefining what we think about recovery related to this condition.
I think that's so beautiful. And, it really makes me think about how, like, it's just so important for people to recognize that treatment and, really addressing the problem early on. And, this is, I guess, what you've been saying all along is that it it's not going to harm the individual in any way. Like, spending a few hours and stuff, working with a mental health professional, like that, there's nothing bad that's going to come from that. And I think that's kind of the hesitancy, at least, like even some of my friends and like the people I know in the South Asian community, a lot of them are really afraid to take that first step because they think it'll almost be a burden, an even bigger burden than, maybe the mental health issues that they're going through right now or like, at the moment. So I think that's just so beautiful to kind of see the full picture and how there is, light at the end of the tunnel. And just after you take that initial step, there's so much good that can come from that. That's amazing.
Yeah, yeah. And I think also like that first step is so critical. I think,
Mhm.
when your mental health is doing better, you're able to perform, right? You're able to achieve the things you want to do, right? And I think like that should be a real motivating factor of like not waiting until it's like at a super severe level. I think sometimes there's this sense, even in the community, South Asian community, of like what qualifies as a valid health concern. I think sometimes like it's like has to be something so severe. And it's like actually like mild anxiety and depression could also qualify, right? Like, shouldn't we get ahead of it before to improve the person's ability to do the things that matter to them and uh, you know, I think like thinking about it in that way might resonate for some families and some individuals rather than it's like, you're taking treatment because you're sick. I think seeing it as like, this is an early investment in myself and in my health. And so that I can do the things that matter to me so that this mental health thing doesn't get in the way as much of my day
Absolutely.
to day.
Yeah, and I think just that initial step, it's I'm sure it's such a big and scary one for so many families, especially families with language barriers or families who have maybe like just immigrated and stuff. And I don't know, are there any I know we talked a little bit about this, but are there any strategies you found that kind of help families make that first step, like that first push? I know you had mentioned kind of helping um kids get a glimpse of what treatment might look like through your schools and through those programs you support. But are there any other outlets? I know you'd also mentioned social media. So I guess what's the way you're kind of able to bring patients in and, get them that help as early as you can? Have you found anything really successful?
Yeah, I think first is figuring out how, like, if it is the kid that's advocating for their care,
Mhm.
or, oftentimes that's the situation I'm in. I will say first developing the language of like having being able to even talk about it, I think, with
Mhm.
your family and saying, hey, I think I'm really struggling. Like,
Yeah.
I need help, and being open to maybe the solutions that others are giving, but then also having a couple of your own that you want to try, if
Mhm.
that includes mental health treatment or not. Support can look like many different things, right? It might be that your buddy checks in on you, on a day-to-day and text to check in. It might look like y'all go to the gym together or get coffee once a week, or like, maybe it looks like a religious or spiritual thing where you go to the
Mhm.
temple, or, doing those kinds of things. It also could look like, I think I need to find a therapist. And so there are like some really good directories that have like a listing of South Asian therapists. I think one thing I'll mention is it really does help to have a provider that understands your background or is willing to be open enough to understand your background, because culture inextricably is impacts your mental health and kind of the way in which you might experience different things or react to different things. And so having that shared understanding can really help, because then you can kind of make progress. You're not having to explain everything, right? You're just, they understand, what
Absolutely.
the auntie vibe or the uncle vibe, like they kind of get it.
Mhm.
And so finding a therapist that has your shared background, and there are a list of directories. Maybe I can send over a couple of links for that. I think the second part is, seeing a psychiatrist. Like, child psychiatrists are lovely people. We're not scary. We're really warm. It's just talking and understanding what's going on. I think for the children that I work with, I wish they would have come to me sooner, because I know I could have done things to help prevent sort of the more intense treatments that they got. Like, I could have prevented potentially them ending up in a hospital. Like, I could have done things to maybe prevent them from going to like a residential treatment center. Like, had they come to me sooner. So, like, not waiting until things get super severe before you consider psychiatry support. um and it doesn't mean, just because you go see a psychiatrist doesn't mean that you're going to take medicine or anything. It's just at least to get the first step started, so that if the point comes where you do need that, you're not waiting 6 months before that
Absolutely.
point. um I think the other thing is, in terms of like finding support, is, at least from what I've seen on social media, like, a lot of people are sharing their story, and I just wish more people would. We need all the stories to be shared, so that, we have a diversity of representation on these social media platforms. And I'm just like so grateful that I've seen some people really share vulnerably, or write books, or, do podcasts like this to share their experiences. And I think, like, that's how we move the community forward in terms of
Mhm.
being more accepting, more understanding, and more supportive of people going through mental health experiences, rather than them feeling ashamed or guilt ridden or like isolating from the community.
100%. Yeah, and speaking of isolating from the community, I think my biggest takeaway from, this whole conversation has been just the fact that you can be so deeply integrated into your community and still be able to embrace all of these, really, even if they're really niche, like cultural norms and stuff. And you can still do all of that while, being able to seek treatment and care for your mental health.
Yeah.
Just because I've seen so many, like, at least made the South Asian youth that I'm friends with, and even, some of my parents' friends, there's this kind of approach of like, it's like all or nothing with the South Asian community, or like for example, in my case, like the Indian community, where um they're either viewed as like very toxic and like very competitive, or you have to kind of like, and you just have to separate yourself from that. And there's no in between. So it's like either you're caring for your mental health or you're embracing your culture. But again, I guess I mentioned this before, but I just love the fact that you're pointing out the room for some of that intersection, and the ability to care for your mental health, but also really keep some of those beautiful parts of your culture intact and build on both of them and make it into something really beautiful. That's awesome.
Yeah, absolutely. And I think so much of like maintaining community and cultural connection relates to your ability to manage difficult conversations if like, some nosy auntie or uncle is, asking a bunch of stuff and being able to provide a response that is generic if you don't feel comfortable sharing, or if you do feel vulnerable enough to share and
Mhm.
safe, then like sharing. And sometimes like people are really surprised they're, of how understanding people are. I think
Mhm.
sometimes there's also this assumption of like, oh yeah, they're gonna like have negative attitudes towards me. And that's not always the case. And so,
Absolutely.
sussing it out and seeing how it feels. But yeah, and then I think, yeah, it's like people management, like learning how to manage relationships in a way that feels good to you. Uh, I think is the key piece there.
Absolutely. And just to, I guess, like as we wrap up our discussion, I know we had started our conversation talking about, your motivations for going into the field of work you are in. Um, are there any really big takeaways, I guess, you've had from your career so far, or is there anything that's had any like big mindset or like shift in the ways you've either approached mental health or even mental health for yourself? Is there anything that you found like really fulfilling from your career?
Yeah, I think there's a couple of big shifts that happened within me, and how I view things. I think
Hmm.
one is that psychosis is unique to each individual. Like no two people's experiences of psychosis or mental health are going to be the same. And so knowing that there's like a spectrum and so much heterogeneity in how these things present, and not making assumptions around what it could be and what it shouldn't be. I think the second big takeaway is that there are ways to help family members and individuals communicate better. Like, I think sometimes it's really easy to feel defeated. Like, oh,
Hmm.
I'm never going to be able to change these people's minds, or I'm never going to be able to bridge this gap. Honestly, I think people just need time. They need gentle support. And I have seen such amazing change sometimes in family members. I would say the third thing would be not to assume that someone with a mental health condition is not going to be able to achieve the things that they set out to do. Like I have been wrong so many times. I know now, like not to assume how far these kids are going to go.
Hmm.
I'm just here to walk the journey with them, support them along the way, and give them every opportunity that I see that might be helpful to them. And I think like, yeah, like just not being, I think having like more a hope-filled recovery oriented perspective rather than like, oh no, you have a serious mental illness. Like, no, like that is not how I approach this anymore. I really say, hey, you've got this thing. This is what the label is for it. Guess what? There's many people that live with this, and many of them do really well as long as you find the right combinations of supports that help you live alongside this condition. And I think like that's been a perspective shift for me. Um,
Absolutely.
I
And
will say the other thing I'll just quickly share is that like it's such a rewarding field. Like I think being a child psychiatrist with these families, I just feel like there's such a sense of reward, being able to work with my community and also understand. Like I feel like I keep learning in working with these families. No two families, even if they're from the same part of India or same background, they don't have the same experiences. And so it's also an opportunity just to learn and enrich my own knowledge about South Asian culture.
yeah, absolutely. And I know you mentioned like how rewarding it is, and all I can think about is how optimistic you must feel. I'm sure like have you noticed that? I know throughout your career, just being able to see like more hope and light in things. Maybe that's an overly optimistic approach I'm having, but even after this
Yeah.
conversation, I have like a massive smile on my face, and I'm like, wow, like hearing about these stories and and seeing these kids, and obviously I'm sure there's so much stress that comes with your job as well. And there's a lot of moments that feel very defeating. But I'm sure like the optimism as well. It must have a pretty nice impact on you.
Yeah, no, there are definitely hard moments, but I think the good things, like the wins that our kids have and just like the rewards
Mhm.
really outweighs maybe the stress and the negatives for me. I've I think it's changed as I've gotten to work with the population that I work with, honestly, and as I've gotten to work with people over time. Like some of the kids I've worked with now for like 2.5 years or longer. Like I've seen them from high school to college.
Oh
And
wow.
like, so, I've seen them literally grow up in front of me and really shift the way in which I think about, like I said, these conditions. Like I just I don't know. It feels also better. I think like not scaring families, definitely relaying the gravity of a diagnosis, but and also at the same time holding hope. I think two things can be done at exactly the same time.
Mhm.
And that's like the art of my clinic, I think, and child psychiatry in general, right? Not scaring families, but conveying important information and then giving them every resource they need and under being with them on that journey of understanding. It is such a privilege and is such an honor.
Yeah, absolutely. And I think yeah, this is a beautiful way to end off, but I know you had mentioned some resources and some supports that you is there anything that you maybe want to shout out right now? And of course I can post whatever in the caption just to make sure those resources are accessible, but um yeah, is there any organization? I know you had mentioned that organization you
Yeah.
volunteer for.
Yeah, there's an organization called Our Cause, which we'll link it in the description, but it's an amazing organization that focuses on storytelling, so mental health awareness through storytelling and community dialogue. They actually hold events here in the Bay for folks to just get together and talk about mental health or different topics. And they also have a blog where folks can share their story, either openly or anonymously around mental health. And so if folks are interested or curious, feel free to take a look and also share your story. And then I'll also share, I think one social media platform and therapist whose work I think was honestly very foundational to my understanding of even my own self and understanding like how mental health showed up in me or my family was Sahej Kohli and her work. If you can find her on Brown Girl Therapy on Instagram, and she just has such amazing work. I highly recommend folks check her out and the programs that she runs as well.
That's awesome. And I guess is there any shout out for yourself that you want to give? I know I first discovered you on social media,
Oh
and
yeah,
I
I
just
have.
wanted to find. So, is there any like social media or some of the research that you do that you maybe want? I don't know. I know our audience right now is small, but if we can get your work to a greater number of people, is there anything that you would like to kind of share?
Yeah, I am on social media. I feel like so unconfident on Instagram, but I do have an Instagram if folks are curious. It's Dr. Bot MD. I do have some research coming out in the next year or so, some of it that will relate to South Asian mental health. So stay tuned for that. It's looking at like suicide rates and things in our population. There's a bunch of talks that I'll be giving later this year too. So you'll see that. I usually post about it on my Instagram on stuff that I'm doing and what I'm up to. And then if anyone is interested or curious, our Child Inspired Clinic is really small. We're a small clinic. And so if anyone's interested in supporting it, you can find the link to donate also somewhere on the Stanford Children's website. If you just look up Early Psychosis Clinic, feel free to donate there if folks want, but no pressure to.
Well, thank you so, so much for your willingness to participate in this podcast. I know I learned so much from our conversation. Hopefully other people will too. Thank you so much. This I just love being able to talk to, professionals that have so much lived experience because it's just so eye-opening for me. Just thank you so much.
Yeah, thanks for having me. Really excited to be here.